So I was asked to talk about health and human security and the links in conflict zones between health outcomes and conflict, and using the lens of human security. So I thought where I should start is this new report that Niels Petter referenced. So the human security report looked at, the original intention of the human security reports were to look at violence and conflict, or the violence and local violence and in conflict zones. But this one, they looked more broadly at the health outcomes in conflict zones. And more directly, how do you measure the human cost of war? So how do you go beyond the battle death data? And they started with this figure you usually hear cited, which is the 9-to-1 ratio. So 9 non-battle deaths for every battle death. And of course they found that there's actually no data that this is based on. And nobody can actually track where this figure comes from. And the same with the 4-to-1 figure you often hear. So they looked deeper at the way in which non-battle deaths usually get calculated now, which is excess mortality. So what excess mortality does is it takes the mortality rate pre-conflict, does a survey of the mortality during conflict, and takes the difference between them and estimates the number of non-battle deaths during a conflict. But they found a few problems with this. One was that the baseline data is often really bad or wrong. Two, that the baseline data that they use often ignores trends. This is the most important bit, in that very often mortality rate is decreasing before a conflict starts. So if you take only the singular point at the beginning of a conflict, then you're not accounting for that potential decrease in mortality. And the third is that the surveying techniques used during conflict are incredibly difficult. So how do you actually estimate mortality in the middle of a conflict at a local level? So one of the things they did is they used different baseline data to look at the mortality rates that the IRC came up with for the DRC. So the number which puts it as the biggest mortality rate since World War II is 5.4 million, and if they change the baseline starting point for that, they drop it to about a third of that, and it's been quite controversial, even since it came out just a couple of weeks ago. But this isn't the same phenomenon they're talking about. Isn't limited just to DRC. So due to the factors Niels Petter mentioned, which war being industrialized, targeted, localized, and insurgent type conflict, the success of global health policies, immunization and vaccination programs in particular, leading up to and then during conflict, and advances in humanitarian assistance have all dramatically decreased the mortality rates during conflict. And they demonstrate this by looking at under 5 mortality rate during conflict, during a series of sub-Saharan African conflicts. And these are just some of them, just to show briefly. The blue is the under 5 mortality rate, and the dark background is the period in conflict. So Angola there is a clear case of this. Ethiopia in the middle, Mozambique as well, all through the conflict period, mortality rate decreasing. And Sudan and Uganda, the same thing. So what I think this tells us is, regardless of the methodological problems, excess death at a national level isn't a particularly good indicator for the human costs of war or for humanitarians who are interested in reducing the human impact of war. Aside from advocacy, and its large battle death number, non-battle death numbers, or human cost numbers are useful for advocacy purposes, and they certainly have been for the DRC. National figures are of little use for humanitarians working in conflict zones. Instead, humanitarians need to know who's at risk of dying at present during a conflict, where and from what causes, and how many have died nationwide, rather than how many have died since the war began. They get this information currently from small-scale needs assessment surveys, and these are widely used by humanitarians in conflict zones. They're critical for creating an evidence-based or humanitarian needs assessment, for monitoring, for impact evaluation. The problem is that they're uncoordinated. Data sets are collected by different organizations, they're not compared, and they're not brought together into singular analyses. My argument I'm going to make here, I'm going to go through some of the processes which I've worked on to do this, is that we should be embracing targeted, localized data and accepting high degrees of subjectivity in this data. And the concept of human security, which I'll talk a bit about, is potentially of use for doing this. The first thing I want to talk about is the definition of human security and where this debate came from, and Niels Petter is right that I will do it at length. If we're looking at subnational vulnerability, so we're not looking for national data, we're looking for local data, then shifting our focus of our security studies from the state to the individual can actually be quite useful. So what human security does is it looks at what's actually threatening individuals as opposed to what's acting threats. And if we do this, the threats to the integrity of the individual rather than the integrity of the state move from things like interstate war and nuclear proliferation to things like disease, poverty, natural disasters, localized violence, so on and so forth. This has been categorized generally as the broad versus narrow debate. So a broad definition of human security is a development-focused definition of human security, which looks at all potential threats to the individual. And the freedom from fear or the violence-based one looks only at the threats to the individual from violent outcomes. The reason for the broad definition, which is rooted in the original UNDP articulation of human security, is simply what people are dying from. So these are 2,000 mortality rate, or mortality totals, and communicable disease obviously vastly outnumbers everything else. So the broad defenders of human security would argue that this is it's difficult, it's a challenge. It means that if we're shifting our reference to the individual, we have to now deal with 20 million deaths as opposed to far fewer. But this is a necessary but unfortunate but necessary consequence of shifting the reference to security from the state to the individual. The narrow proponents, this is the Canadian government and a host of academics who argue we should focus just on violence as the central point of human security, is really a feasibility argument, both a policy feasibility and an analytic feasibility. So Andy Mack, who authors the Human Security Report, argues again that if every threat to the individual is considered a security threat, how do we prioritize? This can't possibly explain anything if everything is a threat to human security. And these are the same two other academics which make similar arguments here. The causal relationships are incredibly difficult to establish if everything is a dependent variable, a human security threat, and it's difficult to prioritize policy as well. If a national government's policy prioritization is human security, then is every threat to everybody everywhere a national security priority? And this, I think, has led to a paradox. So these are the various definitions of human security. And along the top are the UNDP categories of human security. So UNDP has divided the concept into these 7 categories. And what you find is that really very few of the definitions fall into either the entirely narrow or entirely broad camp. It's sort of a scattershot array where different definitions grab different components of human security and justify that under their either personal research mandates or institutional mandates. But what you find when you look at all of those definitions is that the more conceptually accurate, so the broader a definition attempts to be, so to be conceptually accurate, you have to include all threats to all people in all places. The closer you get to that, the more difficult it is to actually actualize it. The more practically and analytically feasible, the less practically and analytically feasible the definition becomes. So what you're left with is the concept of human security being narrow and policy relevant. So in the case of the Canadian government, they've taken a narrow definition and been quite successful advocating it through the Landmine Convention, certain small arms treaties, child soldiers, conflict diamonds. So they focused on violent threats and been quite effective. Or you can be broad and accurate, like the UN has tried to do, and the UN has largely failed in implementing the concept of human security, and now the whole organization is shifting away from even using the concept at all.